Today on Experts on Demand, we're at the Bluepoint Surgical Group in Woodbridge, Virginia, and we're being joined by Brittany Ray, who is a registered dietitian with the center. One of the things that sets apart the Bluepoint Surgical Center from other weight loss centers is that they do offer a very comprehensive program of nutrition and counseling even after weight loss surgery. First of all, welcome to Experts on Demand, Brittany. Thank you for joining us today. Let me ask you, we've talked a lot about weight loss surgery today. I assume that you're a big part of the counseling and care after surgery, making smart nutritional choices. What about before the surgery? Are you working with potential candidates then too?
Right. What typically happens when someone comes in and is interested in having weight loss surgery, we first look at the route. Are they going to try to go through their insurance or with other means? And if they're going through their insurance, oftentimes they're required to do a 6-month program or a 3-month program to get their insurance to even pre-authorize their procedure. So what we do here is I take them through the process. They go through a 6-month program. Probably 80% of people do that. And what that does is not only gives them the time to get ready for surgery, hopefully they learn some, a few things through the process as well. So we start them off there. They go through a weight loss nutrition program before surgery once their insurance has approved them. So then, we've already probably have 6 or 9 months under our belt of getting to know each other. They have surgery, and then we have them for life. They come back every 3 months for the first 2 years, and then annually from there on out.
So Brittany, in addition to the nutritional aspects of aftercare after weight loss surgery, are there other parts of the program that you offer here at the Bluepoint Surgical Group?
Definitely. We work very closely with a therapist, with a licensed therapist, who, because a big part of weight loss is emotional. So we work very closely, him and I do together, and we go through that. A big part also is the supplements. We sell supplements here in the office that are specifically geared toward people who are having lap band surgery and gastric bypass surgery. So we're not sending our patients off to Walmart or just some retail store to say, here's the vitamin aisle, just have fun. We give them specific details of what they need, what vitamins are good for them, chewables, liquids, protein supplements, and kind of take care of everybody from a full circle.
And I understand you also offer support groups?
We do. We have twice monthly support groups here at Potomac Hospital, the first and third Thursday of every month. Dr. Halmi and I are always there, and we're kind of the mediators, and we let the patients, it's their group, so we let them kind of do what they want to talk about. If they have specific questions, it's rare for them to get a one-on-one experience with a surgeon, to get to sit down with him and really pick his brain and ask questions that sometimes they don't have time to do in a consult. So they do that, and we sometimes have speakers. This for the holiday season, we're having a holiday party. So it's a great time for patients. Weight loss oftentimes is a really lonely road, for these folks. So the support is huge. Patients who come to a support group and who participate with us do much better than patients who just kind of fall off into the background.
If someone is not a candidate for weight loss surgery, would you also offer something at Bluepoint Surgical Group for them in terms of nutritional support and programs?
Definitely. If someone comes in the door looking to have weight loss surgery or not, maybe their doctor has referred them for something completely different. They come in, there's 2 registered dietitians that work here, myself and a young lady named Ashley. And what we do, we have a non-surgical weight loss program where we start to work with OptiFast, which is a full liquid diet. We start patients off, not always, but it's pretty typical of our program to start you off there, get some weight off of you, and then teach you what you need to know. It's not beneficial for me to give someone this fad diet of some liquid diet, and then what happens when you stop doing the liquid diet. So we try to get some weight off of them and then teach them everything they need to know to build them back up. And it normally is about a 12-week program.
And what type of weight loss can they typically expect?
Non-surgical patients?
Yes.
The idea is that we get them to lose about 10 to 15% of their excess body weight, which, might not seem like a lot. If someone has 100 pounds to lose, they lose 10 or 15 pounds, but that's 10 or 15 pounds. It gets them on the road to success.
Makes them more healthy.
Definitely. Gets them going, and oftentimes that's what they need is a jump start. Most times patients who need to lose in excess of 80 pounds, they've lost a lot of weight in the past. They know what to do. Oftentimes they just need someone to kind of push them. So.
Well, thank you so much
You're
for
welcome.
joining us. You've been very informative.
Thank you.
We appreciate it.
Thank you.